Good morning, everyone. We'd like to thank you for joining us for today's webinar, Developing an Effective COVID-19 Vaccination Policy, which is sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. I'm Scott Parson, one of the chairs for the Roadmap to Recovery Coalition and the CEO of Staker Parson Materials and Construction. For any of you who don't already know, the Roadmap to Recovery Coalition is a business-led coalition that's focused on implementing and promoting our economic recovery. Throughout the past year, many businesses have focused on preventing the spread of COVID-19 in the workplace. Now that vaccines have been developed, employers are faced with new questions. Can employees be required to be vaccinated? And do businesses need to have a formal vaccine policy? During today's webinar, we will address what an employer can and can't require, what a vaccine policy is and what it includes, who needs a vaccine policy, and when it can be put in place. We have partnered with SixFifty to present this webinar on vaccine policy and are joined today by Marie Kulbeth, COO and General Counsel of SixFifty, and Ryan Parker, who's the Vice President of Product for SixFifty. This is sure to be an informative session. If you have any questions during the presentations, please feel free to submit a question using the Q&A function, and we'll do our best to answer as many questions as we can. This webinar is also being recorded and will be made available on the Salt Lake Chamber's website so that it can be watched and shared after today's webinar. So now we'd like to hear from our guests and we'll turn it over to Marie.
Thanks so much, Scott, and thank you to the Chamber for hosting this webinar today. We think that it's a really important and timely topic for businesses throughout our state. I'm going to do sort of a quick introduction for both Ryan and myself and talk a little bit more about SixFifty and what we're doing. SixFifty is a legal technology company. We're a subsidiary of the law firm Wilson Sonsini, which is a large international firm that focuses on emerging technologies and biosciences, but also with that, there's a big focus on entrepreneurship and growth-based businesses. So they were interested because of their clients in technology and how it's impacting the legal practice. And that led to essentially the founding of SixFifty, which focuses on taking the law's best human touch and expertise and combining it with technology to make it more accessible. So SixFifty's mission is to make the law more accessible to both individuals and to businesses. So we have a pro bono arm that focuses on helping individuals access legal services, but we also have, of course, our business focus, which for the most part is based on privacy issues and employment issues. And that's how we ended up focusing so much on COVID issues. As a business, I'm sure that all of your businesses have faced a lot of new legal challenges in the last year, adapting to changing regulations, adapting to workforces that may have been forced to work remotely, or if your business wasn't able to go remote, finding ways to still stay in business when your workforce wasn't always able to be on the premises. So as we started working on COVID issues, we created return to work policies that we automate for our customers, taking the legal side of what's required and combining it with the policy side. And so we started in COVID telecommuting policies, return to work, and those issues. And then as the vaccines started to come onto the scene, which we're really grateful for, we also expanded our focus to include what isn't allowed, what does a really good quality policy look like, and building those into our automation technology. So we spent a lot of time with employment experts from our parent law firm, with doctors, with others, as we've crafted these tools that we offer. And so Ryan and I, with my emphasis being on Ryan, have spent a lot of time on this, and we're going to kind of talk you through some of the legal requirements, both at a federal level and at the Utah level. And we'll also talk about beyond the requirements, best practices, and some of the concerns that you should take into account as we're talking about these things. So I'm going to turn the time over to Ryan first. Ryan is our Vice President of Legal Product. He's a former Justice Department attorney with years of experience in compliance and regulatory work, but also litigation. So he knows both sides. And he's the perfect person to talk to about these types of issues, both because of his background and because he helped build the tool itself. So Ryan.
Thank you, Marie. I appreciate the introduction, and I'm looking forward to our conversation. As Scott mentioned earlier, feel free to put any questions you have into the Q&A button at the bottom of your screen, and we'll try to answer those if we can, if they're on topic while we're presenting. And if not, we have a Q&A session planned for the very end of our program. But we'd love for this to be interactive, and we'd love to try to answer your questions as they come up. So today we're going to talk about developing an effective vaccination policy. And there are a lot of different issues surrounding COVID-19 and the return to work. And we'll try to stay focused kind of on vaccinations, but vaccinations touch on a lot of different aspects of the return to work. And so feel free to ask those questions. We'll do the best we can. Marie and I are both attorneys. We won't be handing out legal advice, but we're happy to share as much legal information as we can. And to try to help you as you think through these interesting issues. Why don't I start with a little bit of a roadmap for our webinar today? So as I said, there are a lot of different things we could touch on in the COVID-19 arena, but we're going to try to stay focused on developing an effective vaccination policy. And so we'll start with legal guidance regarding vaccination policies. I'll touch on the federal guidance, and then we'll hand the time over to Marie, who will talk about some of the interesting developments that are going on in the state of Utah. After that, we'll move on to talk specifically about policies, about vaccination policies, and the difference between mandatory and voluntary policies, and some of the pros and cons of both of those different options. We'll then also talk about best practices when creating a vaccination policy. And we'll finish up by looking at some different solutions, and specifically we'll show you our SixFifty solution for generating a vaccination policy and keeping it up to date before we open it up again for a Q&A. So let's jump right into the federal guidance on vaccination policies. As the vaccine was being developed at record speed, there was a lot of discussion in the business community about whether businesses were going to be able to require their employees to be vaccinated. And as an attorney, I think it's a fascinating legal issue that implicates a lot of different legal principles. But in December of 2020, the Equal Employment Opportunity Commission, the EEOC, came out with some guidance about vaccines. And as a reminder, we'll be sending out this slide deck with an email to all those who have registered for the webinar. And when you get the slide deck, that guidance is hyperlinked in the slide, so you can look at it yourself. But the EEOC put out some really interesting guidance that essentially explained that in most situations, businesses will be able to require their employees to be vaccinated. And there could be some situations where that's not the case. You know, if you're a business that's completely remote and your employees are not coming into contact with each other or with customers, that may be a different situation. But if you're sort of in a traditional business model where your employees are coming to the office, they may cross each other in the hall or in common spaces. People, will be using common areas like kitchens or restrooms. The EEOC guidance, I think, supports a finding that you likely can require your employees to be vaccinated. I think a lot of businesses have kind of thought that this is a hot button issue, that they would like to maybe just be told what to do and not have to make the decision. But unfortunately, that's actually not what's happened. So the EEOC has said, businesses, you can require, in most cases, your employees to be vaccinated. But there is currently no requirement that employers vaccinate or mandate vaccines for their employees. And so what that leaves is a situation where businesses are left to choose whether to require their employees to be vaccinated or not. Currently, the OSHA, the Occupational Safety and Health Administration, has not said that businesses are required to vaccinate their employees. And that's really that there is a requirement that OSHA's put out that employers provide a place of employment that is free from recognized hazards that could cause serious harm. And some have speculated that this responsibility or requirement could give rise to a vaccine requirement, but we haven't seen that. Another place that we could see some movement in this area is from state agencies, specifically state occupational safety and health agencies, could also step in and require certain businesses to mandate vaccinations. And as I think about that, we help businesses across the country with the return to work. And Cal OSHA in California has been very active in that regard. OSHA in Michigan has also been very active. And so I think we could see some states that step in and have something to say about requiring vaccinations. Along those lines, we want to take a minute now and look at what is happening in Utah with regard to vaccination policy. And I'm going to turn the time over to Marie to touch on that subject.
Thanks, Ryan. So while we're looking at Utah, I wanted to start by sort of giving an update for anybody who may not be aware as to where we are right now with Utah vaccinations. We have reached, I would say, like a fair number of the population if we compare ourselves to other states with vaccines at this point. They're currently available for people who are healthcare workers that work in long-term care facilities or are residents of long-term care facilities, first responders, people ages 70 and over, and school teachers for the K through 12 school system. We've hyperlinked so that you can keep track as this changes. We've hyperlinked the website that will tell you who's eligible for vaccines. And one of the reasons that we've done that is we are trying to encourage employers to let their employees know when they may become eligible, because we did just see over the weekend, or I guess on Monday, in Utah County, we had a number of vaccines available and nobody took the slots for the scheduled appointments. So there may be some issues with people not being aware that, they're eligible and, how to go about getting the vaccine. So in those situations, one of the best ways to get the word out could be through employers. So I would encourage you to share that information with your employees. Starting on March 1st, that will expand to also include people ages 65 and older, or people with medical conditions. And we've given you a list of the medical conditions that could qualify somebody to receive the vaccine starting on March 1st. So again, that's just to help you as an employer know where to go, so that you can let your employees know when they may become eligible for vaccines. But in regards to the legal side, we also have our current legislative session is considering some changes to Utah law, which would directly impact vaccine issues. One of those would be the termination of the emergency powers that are being used to enforce the majority of regulations that are controlling both the workplaces and other activities that are being sort of curtailed in different ways because of COVID-19. That termination would mean that when we reach a point where 1.7 million Utahns are vaccinated or have been had COVID and then recovered, that the emergency powers would automatically terminate. Now, again, this is a proposal. It hasn't passed. We are still sort of waiting to see some of the outcomes here. Our legislative session ends in March, so we'll know soon. But one thing just to keep in mind as we're thinking about the pros and cons of the different laws that are coming down the pipeline, one concern that's been expressed with HB 294 is that we don't currently know what the number or what the percentages of the population would protect us in the idea of herd immunity. So, with other vaccines, we know, for example, that measles vaccine, it takes about 95% of the population to reach herd immunity for measles. It's a lower threshold for polio. The threshold is about 80%. We don't yet have the science to know what the threshold really is for the COVID-19 vaccine. In either situation, and if we were looking at people both vaccinated and recovered from COVID-19, We also don't know that they have the same level of protection. There have been, a lot of studies that are being done, and there's indications that if you've recovered from COVID-19, your immunity doesn't last as long. So there's a lot of concerns about, like, if we, pass this rule and there's an automatic termination of emergency powers, it may be too soon. And if the law's been passed, the governor wouldn't have the option of extending the emergency powers. So there's some concerns around that. A lot of, you know, people in favor on both sides, because, emergency powers have been making life harder in a lot of ways. But also, the idea of, being able to give the governor enough leeway to protect everyone so that we can go back to work and we can have uh, a resumption of activities in a safe way. So again, like, we just have, a lot of things are just unknown with COVID, and so this does touch on some of those unknowns. We also have, sorry, if we can go back one slide, a couple more. Sorry, I like to talk about legal stuff too much. Go, sorry, that if we can go on the first legal guidance Utah slide, I think. Okay. There we go. Sorry, technical issues. Okay, so another House bill that's being considered is HB 117. This one is really interesting. It would prohibit businesses from requiring vaccination verification using Utah's statewide immunization system before somebody could receive services. So you couldn't, say, post a sign on your storefront that said, you cannot enter unless you show, you know, USIS proof of vaccination. That would not be allowed. It's interesting. There's, a lot of reasons that people would want to make sure that people aren't being treated differently based on their vaccination status. One particular concern, of course, is the fact that vaccines are rolling out in a manner where there's certain groups of people that won't even have access to them until the summer at the earliest. So there's certainly interest in protecting people from, being treated differently, having separate levels of access to places of public accommodation. Um, but it is interesting to point out that in addition to a prohibition on requiring submitting, proof of vaccination, this prohibition is very specific. It would only prohibit you from requiring that they submit that proof coming from Utah's statewide immunization system. And so this starts to go towards the idea, like, the government only has the power to regulate certain things. The statewide immunization system is one of them. They can control what's in those reports, and they can control how the reports are used. But if you wanted to say, like, we are going to have an employee vaccination requirement, and you're going to have to show me your proof of vaccination, you couldn't require it be this type of proof. You couldn't say you have to give me your report from the statewide system, but you could ask for something else as proof. And so again, like, it seems to be more encompassing than it really is when you start to read the details. The other thing that this would do is it would also give people the ability to ask that their information not be included in the statewide system. So our vaccination reporting system collects information about all the people that are vaccinated. And it would, if this passes in its current form, it would give people the right to, within a certain number of days, send a message essentially saying, like, don't include my personal information in any of your reports. And that information would have to be scrubbed. So there's an interesting combination of, trying to control some of how Utah's reporting system is used, and also giving individuals some control over their information. So as a privacy lawyer, I found that piece really interesting. And then the last bill that's specifically geared towards vaccinations right now is House Bill 308. This one would prohibit the government from requiring somebody receive the COVID-19 vaccination in order to receive any sort of benefit from the government. So whether it were, a job, a government service, access to a government building, anything like that, the government could not require that somebody have the vaccine in order to receive that benefit or service. This one is really interesting. Again, it's applicable only to government actions, not to private businesses. So private businesses still would have the ability to require proof of vaccination in certain situations if they wanted to, but the government wouldn't be allowed to. This one, however, is also very specific that it's related to the vaccine as things currently stand. So, currently the vaccine's been given emergency approval, and the FDA has issued special rules around that emergency approval. With that, we are this rule specifically says we can't require vaccines under emergency approval in order to receive some other government benefit. So if the vaccine later does become required approved in the traditional sense of approval for vaccines, this would not be applicable. This rule would not be applicable. So again, think about things like rules that require vaccinations for school attendance for children. You wouldn't be able to require the vaccine for school attendance, for in-person school attendance, while it's under emergency approval. But if it moved from emergency approval into full approval, then if the legislature decided to make it a required vaccine, they could. This rule wouldn't prevent that. So again, some really interesting things. For the most part, the one that would have the most direct impact on businesses would be the automatic termination of the emergency powers. But the other ones would also have some impact and more impact depending on potentially your specific business and the industry that you're in. I do see that we have a question regarding HB 117, which is the rule prohibiting businesses from requiring vaccination verification, whether it applies to employees or the customers of a business. It would apply to both. So again, like you can ask if you decide, and we're going to talk in a minute about vaccination policies where you may be requiring your employees to get vaccinated. You would still be able to have that policy, and you just wouldn't be able to ask for the specific type of vaccination proof. And if you have a reason to require, maybe customers to show vaccination proof, again, there like maybe some other legal concerns that you need to think through before you make that requirement. But this rule would not prohibit that. It just would be that you can't ask for this specific report from the Utah statewide immunization system as the proof. So that's our sort of Utah legislative update for what's going on in the session. We do also, though, have our own OSHA here in Utah. So in addition to the federal guidelines, we also have to look at what's being required in Utah specifically. And I'll just start off by saying we really haven't seen much yet. So they did issue guidance in late January regarding mitigation and the prevention of the spread of COVID-19 in the workplace. But it's just guidance. They specifically say in it that it's for planning assistance. It's not a standard or a regulation that you're necessarily going to be held to. It's recommendations and helpful information. So again, this isn't a required set of rules the way that they have in California and Michigan, as Ryan mentioned. But it does make several suggestions regarding vaccines, one of which is that it's suggested that you make vaccines available at no cost to your employees, and also that you provide training on the benefits of the vaccine. So again, not required, but if nothing else, I would suggest that as part of your regular prevention program, that you want to be giving training about COVID-19, even if not specifically about vaccines, because right now, with where we are at and the red level for the state of Utah, you definitely want to make sure that your employees are practicing, safe COVID-19 prevention measures, and that you're making them very aware of it so that you can meet your other general requirements of providing a safe workplace. And then second, and we'll talk more about making vaccines available to your workforce as we talk about potential policies you might want to implement. And then secondarily, they recommend that you need to remind your workers that vaccination does not mean they're exempt from other guidelines. So if you start to have some employees who've been vaccinated and they're saying, for example, like, I don't want to wear my mask anymore, I've been vaccinated, they're still required to follow any other regulations that govern your business. So for example, the statewide mask mandate would still apply to them. They would still need to wear it. Part of that is because we don't yet know fully how well the vaccine works in terms of preventing people who've been vaccinated from still being carriers. So there's the potential that you could still have some health effects if people are being unmasked and not practicing social distancing after being vaccinated. There's also just the idea, though, that again, practicing an even-handed policy is always a safer approach with employees. So if you haven't implemented any sort of vaccination policy and you don't have a way of really knowing who has and hasn't been vaccinated, as an employer, this would protect you from potentially introducing hazards to your workplace if somebody just tells you, I don't need to wear a mask, I've been vaccinated, and it turns out later, maybe they hadn't really been vaccinated, and since you didn't have a way to, formally figure that out, you put potentially other employees in danger by letting that person be in the workplace without their mask on or not practicing social distancing. So again, this is a guideline. It's a good thing to think about, though, sort of the trickle down effects of what will happen as more people get vaccinated. I would anticipate that you'll see more and more people that are wanting to sort of shed some of these COVID restrictions that are, we're all getting really tired of. But we still need to practice an abundance of caution so that we can stay open and stay safe. And then I would just say, like, other than this recommendation, we haven't really seen anything specific to vaccinations coming from UOSH. But they did have an emergency rule that they issued in November that did mandate the wearing of face masks by all employees. There's some limited exceptions for accommodations, but keep that in mind and make sure that you're still being really vigilant about that, because the worst thing to see is business is already suffering, and then you get stuck with some sort of fine or other issue that could further impact your business. I do see a question that's come in that I'll just read out loud. There's a business that's providing COVID testing to their on-site employees, who's wondering if they still need to continue testing them once they've been vaccinated. That is a great question that goes sort of into those specifics of some of the things we don't know yet. So we would recommend that you would, it depends. Let me say it this way. This is going to go more into some of what Ryan's about to talk about. There's different types of policies that you might adopt for COVID vaccines. If you're under a statewide rule about COVID testing, you would still have your testing requirements. So if you're here representing one of the local universities or maybe a private school, you have any testing requirements that you're currently required to do certain randomized testing, that kind of thing, the vaccination wouldn't exempt you from that. If the testing that you're doing is completely by your own choice because you're trying to provide a safe environment, and you decided as part of your COVID policy to determine that those who have been vaccinated could be exempted from the testing requirement, again, like, make sure that you're just documenting your decision, that you're putting it into your COVID policy, and that's probably the safest approach there. But if anybody's under like mandated rules to do testing, don't try to get around those rules. Just do the testing and don't exempt employees. And
yeah, that's a great question. Thanks, Marie. And I think that we actually have seen that a little bit in California, where OSHA requires testing in a number of situations, and they've come out and said the vaccine doesn't limit any of your requirements. And I think that's something that we'll likely see for some time before, at least until we know more about the vaccine and what effect it has.
Yeah, and I actually think this is a great time to move over to you, Ryan. There's one more question in the Q&A, but I think it actually goes towards some of the issues that you're just about to talk about. So
perfect. And if I don't address it, we'll make sure to reach it at the end. It'll be interesting to see what happens to those bills that we discussed as the legislative session progresses. But currently, as we discussed earlier, the situation is that businesses are free to chart their own course. And there are essentially three options. A business can require their employees to be vaccinated. They can encourage their employees to be vaccinated without requiring vaccination, or they can do nothing. And I want to spend just a little time talking about some of the pros and cons of these different approaches. And we'll start with the first one, the benefits of requiring vaccination. So there are several reasons why a business may want to require their employees to be vaccinated. First, vaccinations could protect the employees, customers, and others who enter the work site. And so if you have a business where For example, you have suppliers, you have customers, you have partners that are coming in and out of your workspace. You could see a real advantage to making sure that your workplace is safe for your employees and the others who come in. You could also see an opportunity to reduce employee sick days and the need for medical care. A lot of businesses have been hit with employees having to be out for extended periods of time, either because they have contracted COVID or they have been exposed to someone who had COVID. And I think there's an opportunity with vaccines to reduce employee sick days. Another issue that a number of businesses have faced is having to actually shut down when they've had an outbreak. And I think requiring vaccinations could be a way where businesses could protect themselves from the need to close their business because of COVID-19 outbreaks. In addition, I think that a mandatory vaccination policy could help a business to reduce its risk of civil liability or administrative enforcement action. We've already seen cases arising from employees who feel that they received or contracted COVID at work and that their employer didn't take adequate precautions. I know in many states, I think including Utah, there are liability shields, but there are still opportunities for administrative enforcement, and we're still seeing litigation over COVID that I think will continue to grow and will take various forms. And then finally, another benefit is just to further the public health benefits of vaccinations. As Marie talked about, there has been a lot of reporting and discussion of herd immunity and the benefits to having more and more of the population vaccinated. And I think employers could play a role in that. But along with benefits, there are some potential drawbacks to requiring vaccinations. And I think businesses need to go into this decision with their eyes open. So one, requiring vaccinations would require a business to divert some resources to administering a vaccination policy. And we'll talk a little bit more about this, but collecting vaccination information and dealing with exemption requests could take some time and some resources for businesses. Another issue, and this is frankly one that could cut both ways, is requiring vaccinations could negatively affect employee morale and retention. And I think most people are aware that this is a controversial issue, and that some people feel very strongly that they want to work in a workplace where everyone is vaccinated, and others feel like they don't want to be told by their employer that they need to be vaccinated. And I think especially if you're a larger employer, you may have employees that fall on both sides of that spectrum. And so I think that's something that employers want to think about, is how their decisions could affect their employees. Another potential drawback to a mandatory policy is you could see an increased risk of discrimination suits regarding accommodations. And we're going to go into some detail about accommodations later in our webinar, but employees can seek accommodations from a vaccine policy for either a sincerely held religious belief or a medical condition. And I think there's both of those carry different issues that go along with them, and I think that'll be something that we cover later. But dealing with those exemption requests can be difficult, and I think their businesses could see an increased risk of discrimination suits. And then I think the benefit to businesses may depend on the type of business. Again, we work with technologists, and a lot of our computer engineers are in different locations, and they just work together remotely. And so, if your business is largely remote, you may not see as many benefits from a vaccine policy. Whereas if your business involves interacting with customers, or if you need people in the same workspace, there could be large benefits there. So I think that with all sorts of policy decisions, you have potential benefits and potential drawbacks to requiring a vaccine. I now want to talk about kind of a middle ground approach. And this is one that we're seeing more and more in the business community, and that is encouraging vaccinations. So this would be a policy where a business comes out and says, we think vaccinations are important. We think that they can help our business, but we also respect our employees' ability and right to choose. And so we're going to encourage vaccinations without requiring them. So here's some of the potential benefits, and they relate very closely to the benefits of requiring vaccinations, but there could be some protection for employees, customers, and others who enter the workplace. And so if you encourage vaccinations, hopefully you would have a higher percentage of employees who are vaccinated and you get some protection. You could have some reduction of employee sick days. So the more employees that you have vaccinated, in theory, potentially the less sick days you may have at your business. And so encouraging vaccinations could help on that front. You could have some reduction of the risk of having to close your business. As more employees are vaccinated, you may be less likely to have the type of outbreak that would require you to close your business. And you could have some reduction of your risk of civil liability or administrative enforcement. And I think in a situation like that, you could make an argument that you took steps to encourage your employees to be vaccinated as part of your efforts to provide a safe workplace. I don't think that the benefit would be as strong as if you were to say, we required everyone to be vaccinated and we really took those steps to have a safe workplace. But I think there's some benefit there. The potential drawbacks are also related to the drawbacks of a mandatory policy. You would still need resources to administer the policy, and that would include, many companies are including it in voluntary vaccination policies. They're asking their employees to provide proof that they've been vaccinated so that they can monitor, what percentage of their workforce is vaccinated and they can understand the risks. And then you may still affect employee morale and retention. And I think this is one that businesses are going to have a hard time steering clear of this, as we mentioned before, because you have some employees that are going to want to work only around people who have been vaccinated and others who may not want to be told that they need to be vaccinated. And I think even encouraging vaccinations, you could run into this same type of issue. So let's move on to some of the best practices for employee vaccination policies. Now that we've looked at the options of requiring, of encouraging, or if you do nothing, let's look at some of the best practices for actually creating a policy. And one of the things that's interesting here is there is some precedent when it comes to vaccinations. I think in the healthcare arena, businesses that require their employees, for example, to get the flu shot, and we've seen this, but not something that is as widespread as we are likely to see here with COVID-19. And so these are some general policies that I think are helpful. So the first is to create a clear written policy. It's important that your employees understand your business's policy and why you have adopted that policy. This is an important issue that employees care about, and putting your policy in writing is important. Second, you want to distribute the policy to all employees. You want to make it accessible so your employees understand what your policy is and why you've taken that policy decision. And again, that comes to the third point for explaining the reasons for the policy decision. And here's an example that we've seen. For example, at SixFifty, we are committed to the safety of our employees, customers, and all others who enter our workforce. It's a nice introduction that explains why a vaccination policy is important to the company, the commitment to safety. And then in addition, it's important to provide a clear contact point for questions about the policy. And this is a best practice for all policies, but I think is particularly important when it comes to vaccination policies, so that your employees have someone that they can go to with questions about vaccination and how it affects their ability to come to work. It looks like we have a couple of questions. Marie, are these ones you think we should answer now, or do we want to continue on?
It depends on if you want to delve into accommodations now or wait until I know you had been planning to. They're mainly accommodations questions.
Yeah, we have a lot on accommodations coming up because that's really what people are very interested in. So we'll jump to that in just a minute. Let's move on to our next.
There is one that's not accommodation specific that we might want to touch on briefly.
Yeah.
Essentially asking whether there is any sort of legal liability that could attach to the vaccine manufacturers if we are going to start seeing legislation that may mandate any sort of vaccination. Or if we're going to see workplaces that are mandating vaccination, if there's any protection for those employers, if it turns out the vaccine was unsafe, that's kind of issue.
Yeah, and I think that's an interesting issue, especially because the vaccines have only received the temporary approval of the FDA, and they're still undergoing sort of that process. But I think at this point, the guidance that we're getting is that based on the FDA's temporary approval and the EEOC's view of COVID-19 as a direct threat, that I think businesses are probably reasonable in relying on what they've heard from the FDA and what the government has done to roll out the vaccine. But that's an issue that I hope does not arise, and it's certainly an interesting one to think about.
Thanks. Yeah, and I'll just add in, this is also a good indication of why it's also, in terms of liability issues, uh, a, a non-mandatory vaccine policy that's encouraging but not mandatory also provides, again, more protection, because then employees are still opting in to choose to take the vaccine. There's
Yeah.
less coercion there.
Yeah, great point, Marie. That's definitely true. So we've covered sort of general practices for a vaccine policy, regardless of it's mandatory or voluntary. Let's just touch really briefly on some best practices for a mandatory policy. And this is one that you may not think of, but it's a best practice not to administer the vaccine or contract with a third party to administer the vaccine. And there's some interesting reasons for that. One, the EEOC has said that actually administering the vaccine itself is not a medical examination for purposes of the American with Disabilities Act. And there are certain restrictions on requiring your employees to undergo a medical examination. But in order to provide the vaccine, health officials have to ask a series of questions about pre-existing conditions and medical situations. And those questions themselves are what the EEOC has called a disability related inquiry. Those questions are likely to lead someone to disclosing information about potential disabilities. And so because of that, there are certain restrictions that would then apply to businesses who have solicited information that could lead to employees sharing disabilities. And I think that that's a concern. And I think that, if you, as a business, you solicit that type of information, you have a couple of different issues that arise. One, because you've asked for medical information, you then have a requirement to store that medical information consistently with the ADA. And that would mean not in an employee's personnel file and in a manner that's confidential. And two, you could have an issue that arises later where an employee says, I was demoted or I was fired only after my employer learned of my disability because they asked me questions about the vaccine, and they wouldn't have even known about that had they not asked those questions. And those suits can be difficult to defend, but particularly where an employer has asked and solicited information about someone's disability. And so I think that there are some considerations there that businesses should think about before actually providing the vaccine or contracting with a third party to do so. Let me say this as a caveat. I think there are certain industries where requiring the vaccine will be necessary, and there are certainly companies that are equipped to be able to do this, but I think the additional risks and responsibilities that come with administering the vaccine are things that businesses should keep in mind. Another important point is that if you're going to require the vaccine, you need to pay individuals for time being vaccinated. And so, for example, if you require the vaccine and you are having people get vaccinated at, for example, a county site, you need to pay them for the time that they spend going to be vaccinated, this time that they spend traveling, and the like, because that's a work requirement. So those would be things to think about as you're considering putting together a mandatory vaccine policy. Let's move to the second part. The other thing that's super important with a mandatory policy is providing a clear process for individuals to verify that they've been vaccinated. And I think after receiving the vaccine, typically individuals are receiving a vaccine card or something that they can use to show they've received the vaccine. And your business can ask them to show proof of vaccination, but you need a clear process for that. And then the second thing you need a clear process for is allowing individuals to seek an exemption because of a disability or a sincerely held religious belief. And we're going to talk about exemptions in a lot more detail in a moment, but those are the two bases upon which employees could seek an exemption from your mandatory vaccination policy, and you need to have a clear way for them to seek those exemptions. And one of the ways to do
Right.
that, oh, go ahead, Marie.
Sorry, I was just gonna say there's a question that came in that I think is related to that idea. Um, Asking whether, they have employees that travel internationally. Is it okay to require some people to get vaccinations and not others? And so I think that's sort of the other side of this same coin, where sometimes people are going to be saying like, I want to be treated differently and not getting a vaccination. But you may have situations where, the risk and the danger is really different for different types of employees based on their job duties. And so, I mean, the short answer to that is yes, you can have a policy that requires it for certain types of employees and not others, but you do want to make sure that it's reasoned and based on their actual roles and not on any sort of, lurking bias that might be there. So, job role based differences in policies are appropriate.
Yeah, I think that's a great question. And I completely agree with your approach, Marie. I mean, you could see a situation where a business has individuals in different roles, and they would require vaccination for individuals, for example, who are working in their warehouse, who are going to have to be working with different groups of people to load and unload shipments, but they're not going to require, for example, the people that are answering phone calls from their home to be vaccinated because they're not going to have the same amount of contact. And I think that would be appropriate. And frankly, I think it makes sense for businesses to think about who should be vaccinated and who shouldn't be. And so that's a great question. Let me just touch again on the vaccination, the exemption request form part that we were talking about. One thing that we do with the policy that we provide through SixFifty is we provide a standard vaccine verification form where someone can provide that, and it makes sure that information is provided in a consistent way and that employees know exactly how to provide it. This is an important caveat, though. If individuals are requesting an exemption because of a disability or a medical condition, they should be instructed not to disclose their disability or any other personal medical information. And so sometimes that can be done with a checkbox that just says, I'm seeking an exemption because of, for example, a medical condition. And then you can have your human resources people follow up and get more information. But I think it's best not to have them provide a lot of medical information in a form that they're submitting to you when you can maybe do that in a more limited way and ask them sort of targeted questions that aren't going to solicit as much medical information. And so that's an important caveat and one that employers should remember. If they start to ask follow-up questions about why someone's seeking an exemption for a medical reason, that also could be a disability-related inquiry as they dig into that. Let's move now to just the third part of this slide, and then we'll move on to a couple of other issues. When you're asking people to submit a request for an exemption, it's also helpful to explain to them that a representative of the company will reach out. And that's kind of what we were talking about earlier, that it's a way for you to have that personal contact that you need to understand the situation without receiving information that you don't need. And then finally, this is really important, that businesses provide an explanation in their policy that they're not going to discharge or discipline employees who request an exemption from the policy in good faith. And this doesn't even mean that they get an exemption from the policy necessarily, but if you want your employees to feel comfortable coming and asking for that exemption, and employees who do so in good faith should not be discharged or disciplined. So we want to move now just for a minute to what I think is kind of the big question that has already come up in our Q&A. Can a business fire or discipline an employee who refuses to receive the COVID-19 vaccination, but has not requested an exemption because of a disability or religious belief? And this is a question that we get all the time. And I'm going to give you a very lawyerly answer, which is maybe. And I think that in many situations, the answer is yes. The ADA allows an employer to have what it calls a qualification standard that includes a requirement that an individual shall not pose a direct threat to the health or safety of individuals in the workplace. And, if as a business, you can see that someone who's not vaccinated would pose a direct threat in your workplace, then that I think that individual no longer meets your qualification standard, and they can be excluded from your workplace. I think the question that employers will want to ask is, how likely is the unvaccinated individual to expose others at work to COVID-19? And this maybe returns to the question that we just had, right? You know, is this a person that's traveling internationally and then coming back into your workplace? You know, someone like that could be very likely, frankly, to expose others in the workplace to COVID-19. Whereas someone that doesn't come into the workplace, that works part-time from home or works in a role where they don't come into the office, that may not be as big of an issue. So we've already had a number of questions about exemptions, and let's just dive right into that with big question part 2 here. What about employees who cannot receive the vaccine because of a disability or religious belief? Well, if it's a sincerely held religious belief and a disability, a medical condition that qualifies as a disability under the ADA, businesses are required to provide a reasonable accommodation unless it would pose an undue burden. One of the nuances here is that the definition of undue burden is different. So if you're talking about a disability, an undue burden means something that's significantly difficult or expensive. And so for businesses that have employees who ask for accommodations based on a disability, they're required to provide an accommodation unless something is significantly difficult or expensive. That's a relatively high bar. The religious belief exemption is actually covered by a different statute, Title VII. And under Title VII, the undue burden is just more than a de minimis cost or burden on the employer. And so that's something that it is not as high. And that when businesses are trying to figure out whether providing an accommodation would be an undue burden, that standard is not as high for sincerely held religious beliefs. So the other thing that I think is interesting, and we'll move quickly through this so we can cover all our materials, is that, you know, the workplace has changed. And it may have been last February or January that having someone work full-time remotely was not a reasonable accommodation. But now, you know, many businesses have had employees working remotely for an extended period of time. And I think courts are likely to look at remote work differently than they did in the past. Let's move now to just this slide. And this is kind of my lawyerly disclaimer that when it comes to exemption requests from a vaccine requirement, these are very nuanced and difficult issues. And I think that they're ones that should be discussed with an attorney. I think it's helpful for business leaders to understand kind of what the issues are, but it also is important to realize that these are complicated legal issues. So moving quickly on, let me just talk about some of the best practices for a voluntary policy. And this is one that we're seeing a lot in the business community. Again, if you're going to encourage employees to be vaccinated, you need to pay them for the time that they're spent. And I think that's a great way to sort of lead off with a voluntary vaccination policy. Businesses can also offer an incentive. We've seen some businesses say they'll make a one-time payment towards an employee's health insurance premiums, for example, if they're vaccinated. And so there are financial incentives that businesses can offer. They should also ask their employees to submit verification that they've been vaccinated, so the company can tell sort of what portion of their population have been vaccinated. And then they should also explain, if it's going to be a voluntary policy, the employees will not face adverse employment actions if they decide not to be vaccinated. You know, that's an important part of keeping a vaccination policy voluntary. And, you know, keeping it voluntary also helps in a lot of other areas as far as the legal responsibilities, but that's a key one. In the last few minutes we have today, I want to just talk to you briefly about our 650 solution and kind of what we've tried to do to help businesses with a vaccination policy. So we have created a document generation engine that creates a customizable vaccination policy. And it walks a business through a couple of very basic steps to ask them what type of policy, whether they'd want a mandatory or a voluntary policy. And if it's a voluntary policy, what kind of incentives they'd like to offer, if they do want to offer incentives. and who will be administering the policy and some of those things. And then it creates a customized vaccination policy. The policy's created in Word so that a company could then take the policy and further customize it. They can format it the way they want. They can change any of the wording. But this is one way that we've tried to help businesses to create this type of policy that has some nuance and is important. The other thing that we offer with this tool is that we update it. And so as things change and as state legislatures and the federal government, takes different actions with regard to vaccines, we update the policies so that they're always current. One of the issues that we've had with return to work for some businesses is they spend a lot of money creating a return to work policy, and then within a matter of days or weeks, it's out of date because the CDC has changed its guidance, or the EEOC has changed its guidance, or states have changed. And so with this solution, we help you to generate the policy, and then we keep it up to date. And that's kind of how we have structured all of our solutions, as we've tried to help businesses confront these types of issues. We're at the very end of our time pretty much, but I did want to say that we have worked with the Chamber of Commerce and are excited to offer this vaccine generation engine for free to anyone who registered for the webinar. And so we'll be sending out an email that will include a recording of this webinar, will include the slides and instructions on how you can access, if you're interested, a free vaccine policy generation engine. And I know we have a couple of additional questions. I don't know if we have time to answer them before we hand it back over to Scott.
I believe we got permission in the chat to go over time, if that's okay with everybody.
Yeah, let's take a few more questions. And maybe, Ryan, just before you take those follow-up questions, I just wanted to remind everyone that the Chamber is currently conducting a survey on companies' different approaches to vaccines and vaccine policy. And so we would ask that also, the link for that, it's been put in the chat, but we'll also encourage that be listed in the follow-up information that will be sent out to attendees. And we really only need a response per company. So if your company has already responded, then no need to do it again. But if some people need to drop off as we finish these following questions, just would really like to thank you for joining us today. Thank you for your support of the Chamber and your good efforts as we all work towards recovery from the pandemic. And Marie and Ryan, thank you very much for joining us today. And we'll go ahead and continue with a few of the Q&A things that have come in that have been posted.
That would be great.
Scott.
And I think that seems like very valuable information, actually, to know what businesses within the Chamber are thinking about vaccination policies, because I think we can't emphasize enough that this is an evolving issue, that we will see that this issue change and evolve as more and more people have access to the vaccine, as we learn more about the vaccines. And so it's nice to kind of be able to take a temperature for what businesses are doing within the Chamber. I think that's a great service.
Yeah, agreed. I think the question that we should probably start with is the one regarding, is there a definition for sincerely held religious belief? Like, who gets to decide what qualifies? And also whether that belief would have to be applied to all vaccinations or just this particular one. And I'll answer part of the question and then turn it over to you, Ryan.
Yeah.
So yes, there is a legal definition. It's complicated. And there's a number of factors that have to be considered. But as a general rule, when someone claims a religious accommodation, as a general rule, employers are advised not to question the sincerity of the belief, because that's not really the business that anybody wants to be getting into, is determining that sincerity. However, if you do have reason to question that belief, like on an objective basis for questioning it. So for example, you have an employee who has stated to other employees, something along the lines of, well, I just don't want it, so I'm going to tell them that I have a religious objection. Like there can be things that give rise to you questioning it. So, as a general rule, we do not encourage people to question other people's sincerity, but there may be situations where there's reason to question it. But also, as generally, my answer would be it's usually general to vaccines in general. However, there may be other religious beliefs that can be specific. So, in previous cases outside of the COVID-19 space, because I don't know the answer to this in terms of COVID, there are people who have religious beliefs that would, for example, prohibit them from taking any kind of medication that was based in animal products. And so if a specific vaccine was based in an animal product, that could actually be like that more general belief being applied to a specific type of medication. So as a general rule, there's not usually a religious belief that's specific to the medication itself, but to something underlying. So there can be a little bit of nuance there, but as a general rule, it would be to vaccines or to, some sort of more general category, because it would have to again be a sincerely held conviction, um, based on a religious belief. Sorry, not just a political one, which I believe is a follow-up question that was asked. How do we determine the difference there?
Yeah, I agree completely with Marie. And I would just add that, interestingly, when it comes to religious belief, a sincerely held religious belief, it does have to be a religious belief, not a political one. But courts are not really excited to see businesses probing into someone's religious beliefs and whether they're sincere. On the other hand, if someone comes to you and asks for an exemption based on a disability, employers do have the right to ask for medical documentation to help them understand the disability. And so that is a difference there. And I think it's one that could be difficult for employers, excuse me, as they get employees who ask for exemptions based on a religious belief. We have another, and we'll just try to go through these relatively quickly. Can a private college require their students to be vaccinated while maintaining a volunteer policy for college employees? I think there would have to be some reasoning behind a policy like that. If you think that for example, employees are less likely to pose a direct threat to others that they come in contact with than students, then maybe that's a policy that could be justified. I think, one of the difficulties here is that employers need to do sort of an analysis based on their specific circumstances. And if you think students are interacting in ways where they need to be vaccinated and the faculty is not interacting in those same ways, I could see a policy that treats those two groups differently.
Yeah, I would agree there. Just any time that you're going to treat groups differently, you just need to make sure that you've documented and you have your reasons, in case there is some challenge, which will always, be more likely to be challenged by the group that's being given a requirement. Um, and along those lines, in terms of, we had another question that asked, if somebody decides not to be vaccinated, can you ask them to work remotely? So say you have either a volunteer or a mandatory vaccination policy. I would say that the answer is yes, because that's actually one of the choices that might be treated as a reasonable accommodation. As an employer, if you have a requirement that your employees receive vaccinations, and this goes beyond COVID, there's employers that require flu shots. Um, and somebody decides like, I don't want to do that, for whatever reason, whether it's an allowed exemption or if you just have a voluntary policy, if they're like, I just really don't want to, um, you can determine like, okay, maybe we're phasing back in our workforce. You're going to be in our last phase to come back when things are safer, when more people are vaccinated. That's perfectly reasonable. The main thing to keep in mind is whether it's adversely affecting their employment. So, remote work can be a reasonable accommodation, but if you have some sort of other rule that says, only employees who come in for this number of days of the week receive X benefit, that's when you start to see, right, some problems coming when one person gets treated differently. So if they're not asking for an accommodation because you don't have, a mandatory policy, if they're just saying like, I don't want to do it, just think about, okay, that's fine. They don't get the benefit I offered, but is it going to affect like, their job title? Is it going to affect, other things like their seniority? I need to think through the ripple effects when I say, yep, we're going to accommodate you and let you work from home. You just have to think through the other practical aspects of planning how you'll treat those types of accommodations.
And I don't want to run too far over, but I think we could quickly just answer two more questions that are related. One is, if we have a voluntary policy, can we require someone who chooses not to be vaccinated, for example, to continue wearing a mask or doing other things? And I would say, at the moment, people who are vaccinated should be treated exactly the same as your other employees, because we really don't know how the vaccine affects the ability to transmit. And we haven't seen that guidance come down. And so I think at the moment, no, but I think in the long term, that could be, the answer to that definitely could be a yes, if we get different guidance on that front. Because I do think you could say, for example, if you're vaccinated, you're going to be in the first group coming back into the office. And if you're not, we're going to have you continue to work remotely, for example, even if it's a voluntary policy. And I think that hopefully hit a couple of these questions.
Yeah. I might hit really quickly the one that asks if you're providing incentives for people to get vaccinated, are you at risk of discriminating against staff that have an exemption? That's a great question. And the answer is it depends on what incentive you offer. If the incentive is you get paid for your time while you go get the vaccination, I probably wouldn't think you're at risk of being, given any sort of uh, real traction and any complaint about that. But if it's a significant incentive where you're like, we're giving a $1,000 bonus to anybody who gets vaccinated or something like that, and you're going to have a group of people that aren't able to get vaccinated, you probably want to make sure that your policy also includes an option of providing the incentive to those who can't actually opt in. They have one, if somebody's pregnant and they can't currently get vaccinated, that's a you don't want them to. That's a new issue of safety. So think about what is the incentive, and is it one that we need to offer to everybody who's compliant with our vaccination policy? So if your policy is, we give this incentive, and if you have a medical exemption and want to ask for the incentive, you can, think about that. But if it's a simple one where it's like, we pay for your time away while you're going to get your shot, then it's not really a discriminatory problem. But if it's a big incentive, you might want to think about doing something for those people that don't have the opportunity.
Thanks, Maria. I want to be respectful of Scott's time and those on the webinar. I think we've covered most of the questions here. Scott, should we wrap up, or should we keep taking questions?
Yes. No, I think we should probably wrap up. We're a little beyond our targeted time, but I think it was well worth it. And those questions in the follow-up were really, really helpful. And I think, what this has highlighted is how many different nuances there are to be thinking about as we approach this. And, we're all early days for this, right? We're not even to this stage when vaccinations are even an option for, people that are really in the workforce right now. But over the course of the next 1 to 2 months, that's certain to change. So I really think this is informative and useful information. Thank you for your time, Maria and Ryan, for joining us, and to all of our participants who took time today. Look for a follow-up email, and this webinar will also be posted on the Salt Lake Chamber website. So with that, we'll go ahead and conclude and encourage everybody to stay safe, stay well. Remember to still be vigilant in following all of the protocols that we know have contributed to the current decline in infection rates that we're seeing, and are certainly hopeful will continue in Utah. So thank you very much, everybody. Have a great rest of your day and rest of the week.
Thank you. And just for anybody who might have missed the initial announcement, the recording will be sent out in an email along with the link if you want to get that free vaccination policy.
Great. Thank you, Marie. Okay, goodbye.